Well, hello, welcome to Dr. Doctor. I'm Mark Strong, pastor of Life Change Church. I'm here with Dr. Jill Ginsburg, and she is one of the founders of North by Northeast Health Clinic, Community Health Center here in Northeast Portland. Wonderful clinic that has done great work in the North and Northeast Portland for a number of years. And so just glad to be able to talk with her here today. We've been focusing specifically on issues surrounding COVID. So we've talked about exactly what is COVID, what does coronavirus mean, what does COVID-19 mean. We've talked about testing, and today we're going to jump into, I'm sure, a conversation that many of you may have questions about. We're going to talk about vaccines and just hear from Dr. Jill just where we are in terms of that, how vaccines can help and so forth. So Dr. Jill, take it away. Yeah.
Great. So I love talking about vaccines. I talk about vaccines a lot. In my view, and I think, most physicians and healthcare professionals would agree that vaccines are a huge public health tool that have saved, countless lives, things that even, I'm reaching the end of my career, but, I still remember kids dying from meningitis when I started my training, and that doesn't happen anymore. We've got vaccines. We don't see, even in my lifetime and as a doctor, we've eliminated some diseases through the use of vaccines. And that's, 35 years, not a very long time. So, and then, stuff like smallpox and the horrible things that used to kill a lot of people in the old days are history, at least hopefully will remain history. So let me talk a little bit about what a vaccine is and how it works. Vaccines, there are a number of different kinds of vaccines. Basically, what they all do is, you could say, trick our bodies into developing an immune response to a specific infection. So, and there's some vaccines, and a lot of the vaccines in the old days were what we call live vaccines. So they actually give you a very small dose of the infection, and then your body develops immunity. And they hopefully they give you a small dose so you don't get sick from the infection, but it's enough that your body recognizes that bacteria or that virus. So next time you're exposed to it, you won't get sick. So that's a live vaccine. We still have some live vaccines, but most vaccines these days, almost all of them, are not live vaccines. We're not giving people the actual infection. So in a laboratory, they make something that looks like the infection, looks like the bacteria. The coronavirus has these little, you've probably seen pictures where it's got these little spikes on it. It's like a ball, and then it's got these things sticking out. Those are protein spikes. And they can use those protein spikes to create a vaccine that our bodies then will use to develop an immunity to this specific coronavirus. So that's how vaccines work. That's how the flu vaccine works. They're dead vaccines. They're not, you could, take a lot of doses. You would not get the flu. You would not get coronavirus from the vaccine, but you would get an immune response. So that's basically, how vaccines work and what they do.
Okay. So yeah, so I think like myself, like the typical like flu shots. Now I got to confess here, I've had a number of flu shots, but sometimes I don't always get them because I was under the impression. Well, I'll just give you an example. One time I got a flu shot, and the next day I just got, like as sick as a dog. I'm thinking, man, this shot gave me the flu. And so that while that is probably not scientific, I wonder if there's some others out there that may be thinking like I'm thinking. So Dr. Jill, maybe you can kind of help us with that a little bit.
There are lots of people who think that way. I talk about this all day long in my practice. A lot of people get sick in the winter and the fall. It's the time of year when we're kind of we're indoors, we're in enclosed spaces. things, especially respiratory type of infections, tend to spread quite readily. So it's very common, most of us get some kind of infection with either bronchitis or a cold or some sort of upper respiratory crud in the season of flu, fall, winter, early spring. And it's human nature, I think, to associate two things that happen close in time together. So if I get my flu shot Monday and Tuesday I come down with a nasty cold, I'm going to think, that darn flu shot gave me a cold or gave me the flu. It wasn't the flu shot. It was a coincidence. You got the flu shot during flu season when you're likely to get some kind of respiratory infection. So, and the benefits of the flu shot are, so just to go back a sec, the flu shot is what's called a killed vaccine. It's dead. It cannot give you the flu because there's no living virus in there. And that's true of the vaccines that they're looking at for COVID are not live vaccines. They would never give a person a dose of coronavirus. So they're using other laboratory methods to create something that looks enough like it that your body develops antibodies to fight it off if you get exposed to it. But getting back to the flu shot for a minute, I want to just talk about that for a second because we're coming towards flu season. We're starting to give flu shots now at North by Northeast. Most of the big health providers are starting to administer flu shots. And the one of the things that's going to be difficult this flu season is that the symptoms of the flu and the symptoms of COVID, there's a lot of overlap there. So it's going to be very confusing to sort out, is this the flu or is this COVID? So the more people who are vaccinated against the flu and don't get the flu, the better it will be for everybody in so many ways. And when I get my flu shot, I'm protecting myself, but I'm also protecting all of my patients, because if I'm spreading the flu, even before I get symptoms, I could spread it. If I have the virus in my throat or in my airways, I can spread the flu without even being sick, without knowing that I have it. And anyone who's in contact with family members who are elderly or very young, babies, those people are much more likely to get severely ill from the flu or even die. People die every year from the flu, thousands of people. And we can prevent most of those deaths with vaccines. So I encourage everybody to get a flu shot as soon as they're available. Protect yourselves, protect your family, protect the people around you. It's safe. It hurts for a second, and it's the best way to keep yourself and your loved ones safe from the flu.
All right, thanks for that, Dr. Jill. I guess I'll have to change my mind here. Yeah, maybe I wait to get the shot here. So I guess one more question is in terms of the COVID and the vaccine. So you hear a lot of different things in terms of where we are in terms of coming up with a vaccine. Just kind of in your opinion, or for the information you have, where are we exactly in terms of developing a vaccine for COVID?
Yeah, so there's been a ton of work on this, and there's a lot of work going on. We will have a vaccine sometime in 2021. I don't think we'll have it. It's possible, but I don't think we'll have it this year. The process to develop a vaccine takes a long time, partly because they have to they do a lot of testing, and they have to get a lot of people to agree to test the vaccine to make sure that it's effective. First, they test to make sure it's safe, and they test it on a smaller number of people to make sure there aren't any terrible side effects. Once they've determined that it's safe, then they test it on lots and lots of people, tens of thousands of people, to make sure that it's going to do what we want it to do, which is prevent COVID. And it just takes a long time. One of the vaccines that's under development, they had to stop the the testing temporarily because there were some severe side effects that they had to figure out. Is that from the vaccine or is that something else? They decided it wasn't the vaccine causing the side effects. It was just random chance that a couple people had some issues. And so now that trial is back on moving forward, but it takes months to do it safely. And that's why any attempt to rush the process is, it's foolhardy. We've got to do it safely. We have to have people trust in it being safe. And we have to know it works if we're going to ask millions of people to take a vaccine, which we're going to do. And, that's going to be a game changer. A vaccine is going to allow us to go back to some kind of normal life. But we're a little ways out and people are going to have to take it. They're going to have to take the vaccine because otherwise, I mean, if only, 10 or 20% of people take it, we're not going to be able to get back to normal life. If, 70, 80% of people take it, we'll be looking in really good shape this time next year.
Okay. And so in terms of for the vaccine to get traction after people take it, is that immediate or is that going to take some months to happen or how does that work?
To develop immunity?
Yeah.
Yeah. So every vaccine's a little bit different. Usually the immunity develops pretty quickly. Like with the flu vaccine, if you get a flu shot this week, you're going to be protected going into the flu season starting, within a couple of weeks of that. It takes the body a little bit of time to mount the immune response, but it's a matter of, days to weeks, not months.
Okay. Wonderful. All right. Well, anything else, Dr. Jill, that along these lines?
Well, I think, there's been a lot of talk about vaccines and testing vaccines in different communities and how important it is to have representation from a lot of different communities so that we know the vaccine is safe and effective, not just for white men, for example, but for, Black folks and other people of color and, women and kids. That's a whole other, developing a vaccine for kids is a kind of a whole other process. Yeah. But I really encourage people to pay attention to what's happening with the vaccines and to talk with people that they trust about it. Yeah. I hope people will trust in this process and accept the vaccine. I'm worried that people who have, historically been hurt by our medical system will be afraid to take a vaccine. That worries me a lot. There are very good reasons to be distrustful of the healthcare system. We have done some bad things to communities of color, and it worries me that people will not, will not feel safe getting the vaccine. But I'm gonna take it. I hope that you would take it and, share with the people that we, love and see that it is something that's helpful and important for all of us.
Yeah. So difficult times, difficult challenges, and it's going to require us, to, maybe do some things wisely, and making sure we have our information to, require us to do some things that are going to be, helpful for all of our safety, and we just don't advise, like I said, just being, gullible, just doing something off the cuff. But as far as, getting as much information as you can, so that, you can be safe and that, those around you can be safe as well, too. Well, we want to just say thank you for spending this time with us again on Doctor to Doctor, and hopefully some of the information that we shared, I know I've been helped immensely. I think I'll probably start back we'll start back getting the flu shot because of our conversation today. And so again, if you have any questions as relates to COVID, please feel free to just put that in the comment box. And then next time we come on and we do our programs, we'll try to address some of those questions and concerns that you might have. Thanks for watching. And then also, hey, if this has helped you out, feel free to share this with your friends as well, too. This may be information that could be helpful for them as well. So you have a great day, and thanks for tuning in. Dr. Jill, thank you so much today.
Thank you. Great to see you.
Uh-huh.